couldn't transport it in their cars. They didn't have enough space to bring it back to the facility to dispose of it through the hazardous waste, which is what they did at the facility for everything except for the narcotics. So a lot of stuff is ending up in the wastewater, and that's a huge public health question. There's one scientist at, I think it's USGS, his name is Chris Doughton, who is doing a lot of work on this. But the question is not so much what does one individual drug, what is the problem with that, but it's more so what happens when you have this huge cocktail of drugs in the wastewater and they're not filtered out through our wastewater treatment plants. There are a few wastewater treatment plants in the Middle East and in Germany that have started to be able to implement new forms of filtering, but we don't have that here in the United States yet, at least not in this area in particular. So, huge question. How do these differences differ between my three sites? So, for the institutional data, because the palliative care and conventional units were kind of married to each other within the hospital, they were one cost unit. So the data that I got from them was for both of those places. So when you see this list, I'm just going to point out the top one because it's pretty clear and interesting to me. Medical gloves, you're using 67 gloves per patient per day in the conventional and palliative care units. You're using 2 pairs of gloves in comparison in hospice. And it's a difference of practice. When you are a nurse or a physician, particularly the nurses who are doing a lot of the hands-on care, as soon as you think you're going to go into a room, you grab a pair of gloves, you walk in there,